Diabetes. As of right now, there are no FY20 allocations for diabetes. They are going to release an RFA on April the 29th. And there's going to be a phone call on May 1st at 10 a.m. They will send out that information, and the RFA will be due on May 24th. Not everyone that applies may get funding, but if you want to do the diabetes program, MCH Coordinator, last year we wrote out new function codes for the MCH Coordinator. There seem to have been some issues with everybody understanding that these are the only function codes that you can use for the MCH Coordinator. So I kind of wanted to leave this in here as a reminder. Please use these function codes. I've explained to program staff that for fringe benefits and salary and leave, you cannot change those function codes and indirects. So they understand that now. However, if you're doing a direct coding for APs or direct coding for salary, you need to use these function codes and only these function codes. The only change for this fiscal year is there will not be an allocation for cost center 774. That is now going to be part. That is going to be part of 766. And the 200 function code has now been changed to child fatality review. So that is the only change from last year. However, I have put all of the new function codes that were put out there last year on here so that you can be reminded to use these. I think part of the biggest problem is health departments are used to using 129 program general in any cost center. 129 program general is not an allowable function code for cost center 766. So make sure you only use these function codes when coding directly to cost center 766. Here's the rest of them. All right, I also wanted to go over something that we rolled out last year for FY19 was WCPTs. There are no longer WCPTs used with the E&M visits. In years past, we had a W99201 put out there, or W9201 put out there for the nurses to use. That is not required anymore. We only have 99201. The PEFs have been changed, and you should not be entering in any E&M visits with the W code in front of it. The only W codes that we have are for WIC and for vitamins for family planning. Those are the only W codes, and they're listed on the PEF, and those are the only ones that are allowed to be entered. We can't delete them from the system until your FY18 billing and rebilling has been completed, but once CDP says there shouldn't be any more, we are going to delete those W codes out because you all are still using them. So there's some more of the E&M visits, but I'm just wanting to reiterate this because in your clinic and Ride Life Path, there are going to be services that we have uploaded that start with this W code, but nothing's going to be calculated on those because I didn't put RVRVs or rates in there for those. So you need to zero those out. But I'll go over that with the clinic. And for the hospital room, that used to be W01666, and now it's a GO378. So you'll need to make sure that you talk to your nurses and your clerks and explain to them they need to be using the new PEF and not be entering those in. Okay, here are our normal reminders that we go through. Allocations, as you know, were sent out yesterday. I know there was a couple of health departments who didn't get them, but those have been corrected. So everybody should have allocations out there. If you, as like in the family planning, if you decide that you don't want to use the family planning funds, don't just email Women's Health. put your budget analyst on that email too, so that we're aware of what's going on, because we do an initial review of the budget before we send it to program staff, and it saves a lot of people a lot of time if they it saves a lot of people a lot of time if your budget analyst is aware of any arrangements that you've made with program staff. Like if you're requesting additional funding and they've approved it, but you just don't have an allocation for that, but they're going to do an allocation for that and they want you to go ahead and budget it, those kind of things. Keep your local health budget analyst in the loop. And to keep things going, if you complete AFM and program staff budget revisions, as soon as you get those, that keeps the flow of budget reviews going. Once your budget gets through starts the process, we really stay on trying to get those budgets through program staff and back to you very quickly. Budget program staff is very aware when my name comes across their email at this time of the year that they really need to be doing stuff, and I stay on them to get your budgets reviewed. And so we would like for you all to get them back as soon as possible. Our goal is to have everybody's budget approved by June 30th. With budget training being in April, everybody's due May. There shouldn't be an issue with budgets, albeit budgets being approved by June 30th. And you can submit your budget before you have a board meeting. There was a health department one year who totally forgot to budget certain fringe benefits and stuff, and they did not submit it until after their board meeting, and they had to go back to their board and request additional funding after the fact because they had to rechange their budget, and it was like a $20,000 error. So I use that as an example because we really look at your budgets to make sure that everything that needs to be in there is in there. And so if we do our initial review and then you can present it to your budget, you're not having to your board, then you're not having to go back to your board and saying, hey, we messed up, we need additional money. So that's the only reason why I say that is make sure you're submitting it to us and you can do things at the same time. I understand that your board might not have approved something that you've got in your budget and you really want their approval before you do it. You can make changes after you submit it to us, and we can, get that going through the process again if need be. But if you have it all going on at the same time, it makes things go a whole lot smoother because there might be something that we saw that you didn't see. Okay, budgets are due to DPH no later than Friday, May 24th. If you can get it in before then, that's great. We're on a first in, first out basis. So whoever submits their budgets to us first, that's the first ones that we review. We don't skip in line. So if you have a board meeting on a certain date that you want us to review it before your board meeting, then you need to make sure you have it to us well in advance so that we can get that reviewed, because it does take time for us to review these budgets. If for some reason your budget is not approved by June 30th, and when payments start going out, we have the right to withhold any payments until your budget is approved. I mean, if it's something on DPH's side that's causing your budget not to be approved, then obviously that won't happen. But if it's something on the health department side of not getting stuff into us, then we can withhold those payments. Board minutes have got to be submitted before your budget is approved. So make sure you're scheduling your board meetings in May and June so that you can make sure that you have approved board minutes with a quorum to be submitted to us. They don't have to be official board minutes that have been signed off on, because we know that takes the next board meeting to get those signed off on. But send us your board minutes as soon as you can. I have placed all the program descriptions that have been submitted to us on the L drive for FY20. There's not very many of them, so if you have any questions, please contact the contact person on your allocations. If there's not a program description out there, some of them might say refer to last year's. All the years past program descriptions are out there. When balancing your budget, you don't want to use unrestricted reserves for reoccurring expenses. Unrestricted reserves should only be budgeted for one-time expenses, such as capital. You don't want to budget unrestricted reserves for an increment, because that's a reoccurring expense every year. And if your plan is to use unrestricted reserves, eventually those are going to run out. Once you have completed the BUD form, which we'll go over this when we go over the BUD form, make sure you compare your summary of our programs to your budget to make sure that it's kind of in line of where you are this year. There's going to be some changes and so forth, but and we understand that, and we do point some of that out when we review your budget, because we compare your summary to your budget to make sure that, you know, by line items, you're in the ballpark of where you are currently, you know, adding a couple months. You can use restricted and unrestricted reserves, but that's the last thing that you want to budget before you budget your local money. But make sure that if you're using restricted and or unrestricted reserves, that you don't need that money to close out fiscal year 19, because your plan is to use it for 20, but if you use it for 19, you're not going to have it for 20. So make sure that you double check and look at your financials for 19 before you budget for 20. Here's the budget flow. It hasn't really changed anything. We've already loaded your budgets to the L drive. You can download those from the L drive. Once you submit it back to the L drive, AFM, which is your budget analyst, will review it, and 99.9% of the time, we're going to send it back to you, and you're going to make changes. Once you've made those changes, you're going to send it back to us. We'll finally accept it, and we send it to program staff. Every division reviews your budget for their programs, and they have 3 days to review your budget. If they don't review your budget within those 3 days, they get emails from me telling them they're late, and they don't like those. So they're usually pretty good, most divisions, of getting those done and back to me, but we stay on them until they're done. Once all divisions have reviewed your budget, I will send out the denials to you if there are any. If there are no denials, then it goes back to your local health budget analyst, who does the final review and issues the letter of approval. So it is a big process, and this just kind of explains, you know, what the process is. Color coding has not changed. The biggest thing is, unless it's yellow, don't enter. This slide shows how everything is linked. A lot of things are linked to the salary template this year, because we've incorporated some FTE calculations to help with transformation. So I will show as we go through the templates how that works. This has not changed. Your local health budget analyst is the same as it was last year, but this is just a reminder who your contact person is. You need to email your local health budget analyst for any technical issues once you've submitted it on the L drive, or if you just need assistance. We are always here to help if you have any issues with your budget. you can't figure out how something works, don't hesitate to call us or email us, and we will help you to the best of our ability. If you mess something up on your templates, so far there hasn't been anything that we can't fix. So just let us know and we'll try to get it fixed for you. When you submit your budget, you need to, before your board budget will be approved, you have to have submitted your board minutes. And if you're a CH31 county that receives money from the fiscal court, you need to submit your CH31. Those can be uploaded to the L drive instead of emailed if you want to, so it stays with your budget, or you can email it to us. The do nots. I know a lot of people make fun of my do nots, but believe it or not, there are people that do these do nots. So you cannot open more than one template at a time. All templates are connected to the bud form, and most templates are connected to the salary. If you have two templates open at the same time that are connected to each other, it's going to create REFs. And if you save it and close it, the REFs are not going to go away. So then you're going to have to send it to us and we have to fix it. So my suggestion to you is not to open them at the same time. Or if you do open them at the same time, don't save it and then go back in it. Because we all forget to do stuff like that. But don't sort anything unless it has a sort button. Do not delete rows, because if you delete rows, then it creates problems from stuff feeding over to the other documents. Same with inserting rows. Don't hide columns and or rows, because that makes it hard for us to find things that don't balance, because you might have entered something in there and that could be why it's not balancing. Don't copy and paste on the templates. Do not delete a formula in a cell. Do not delete in a cell. I'm going to show you how to use clear contents on like the salary, because salary has formulas in there, but it also has yellow cells that you can type over, but you need to use clear contents. Don't ever, ever, ever use delete. I can't say that enough. Do not use delete. And do not use the cut function when copying templates from the L drive. Make sure you hit copy. This highlights some of the reasons why things were denied in the prior years to kind of speed things up. These are just items that you might want to make sure that you check off before you submit your budget. It's not going to say that it's going to keep you from being denied, just saying these are some highlighted things. This talks about split grants. This is also explained in your budget instructions. There are split grants on your allocations. For example, WIC. It has July through September allocation and October through June allocation. On your allocation, there'll be parentheses that say July through September and a parentheses that says October through June. Yes, on your budget, you have to add both those numbers together to do your budget, but in reality, that one that says July through September will only cover your expenses from July through September, and the other will only cover expenses from October through June. It does not carry over most times. Here's how to get access to the L drive if you don't already have access to the L drive. Those are the instructions, and I'm not going to go through this, but there are PowerPoint slides that show you how to copy your budget from the L drive, how to link your templates if you need to link them after you copy it from the L drive, and how to save the templates back to the L drive after you're done with it. I highly suggest that you do not do your budget on the L drive because it slows it down. So everybody needs to copy their budget from the L drive to wherever they want to work from it on a flash drive, on your C drive, on your desktop, wherever, and then copy it back. The only time I ever suggest that you change anything is if you have minor changes that need to be made when you get a denial. That's the only time I would ever suggest doing anything on the L drive. Okay, that's all for the PowerPoint. Okay, now we're going to start on the salary template. I know we don't usually start on the salary template, but we're going to this time because a lot of things really are connected to salary this year. So everybody should have a budget 20 folder on the L drive, and you should have all of these documents inside your budget 20 folder. When you copy it off, you need to make sure everything is relinked, and I'll show you how to do that. But we're going to start with salary. Sometimes it'll pop open and say edit links. You just click edit links. And down here, there's a location, which, you know, mine's on the flash drive, so it says E and budget 20. So I know it's linked to the proper place. But if it's not linked to the proper place, then you hit change source and you just go through the drop down boxes to link it to the proper place. If that box does not pop open, you can go to data and hit edit links, and the same box pops open so that you can make sure that everything's linked together, since they all depend upon each other for the bud form to be finalized. Okay, the first tab is where you do all of your deductions for salary. You need to make sure that some of them say monthly rate. Some of them are an annual amount. Some of them are like health insurance is a monthly rate. It's an average. We know every employee has a different insurance plan, so that monthly rate is different. The employer portions are annual amounts, so make sure you're entering in that annual amount so it's calculating your salary accurately. And then these down here are for the employee. So make sure that the whatever the employee has withheld that are pre-tax deductions are entered there. We have loaded for all health departments except for the 3 independent health departments. We have loaded what your salary hours per cost center are as of March 31st. We loaded it for full-time and we loaded it for part-time. Yours should have names for most people. However, I didn't want to share this health department's information with everybody, so I've deleted the names. All of that feeds over to this. If for some reason a name did not come in for one of your employees, please fill that out, because we do use the budget templates to do compliance reviews and different things like that. And it's very helpful for us if your names are filled out on this. So if for some reason a name did not come in, because sometimes that does happen, please make sure that it is. I just got a message saying you can't see my Excel screen. There, hopefully that worked. And so in here is where all the hours feed in. It is being annualized based upon all the pay periods through March. And it has it in here for every cost center. The hours that you have through March annualized because there's been 20 pay periods through March. So some people are going to be 1950 exactly. Some people are going to be off a little bit. You just need to adjust the hours accordingly. But this is a starting point. This is not a I got my hours loaded, I'm done kind of like thing. You need to go through and adjust accordingly to get everybody to the number of hours. Most people would be 1950. If like it comes in red on this one person, that person could be somebody who are retired and at the beginning of the year, so they're no longer an employee there. So you want to get rid of that person's information. So if you highlight the row, and right click and hit clear content. Do not, I repeat, do not hit delete. If you hit delete, it messes up the formulas for everything that goes to the bud form. So make sure you hit clear contents. And just because we clear contented that row, you cannot reuse that row for somebody that you need to add. So you would have to go to the bottom and add the new person. And as I've said before, only enter in yellow cells. Yes, some of these yellow cells on the salary template have formulas in there, but because they're yellow, you can enter in them and override the formula. It's just where the information is feeding from where we did the preload. So you would just enter in the next person on the next line. As you can see in column A, it does an employee count. That's very important for retirement and some of the other fringe benefits. So make sure that for every employee you have in there that there is a 1 in column A. Another common mistake that we have with the salary template is they get done, they got all the hours and everything, and then they go to the bud form and there's no expenses. Well, until you enter pay rates in column E, you will not have any expenses carry over to the bud form. So you have to enter a pay rate in for everybody. If you don't enter a pay rate, then it doesn't calculate costs and does not go over to the bud form. So everybody here is making $10 an hour for today. And then that feeds over to the full-time salary that shows you salary costs by cost center. Then you also have the part-time salary you would have to enter into. And here's another thing for full-time. Say this person really does only have 702 hours that you need for FY20 because they are going to retire in FY20. If you right click and hit insert comment, just say employee retiring August 1st. That way it calculates all their fringe benefits accordingly, and you can still leave them on the full-time because they are full-time employees. So make sure if anybody's in red, you either have to move them to part-time if they're not going to work full-time hours, or you need to put a comment saying why they're that way. Give us an explanation. That way, if you insert the comment, we're not having to email you and saying why and so forth. Okay, so like on this full-time, this 1 hour is like $14.20, and it's red because the part-time tab should only have under 1,200 hours, up to $11.99. So if they're an actual full-time employee that's working more than 1,200 hours, they need to be on the full-time salary tab because of benefits, for the proper calculation of benefits. So you would need to clear content them off the part-time tab and enter them on the full-time tab. We're going to put pay rates in for our part-time people. All right, and then all of the part-time calculations go over to the part-time salary, so you could look and see by cost center how much you are budgeting salary for. The next tab is a salary spread. Yes, there are red and yellow boxes, which means there might be an error, but if you compare G and E to each other, and they're within dollars difference, then it's just a rounding issue. However, if there's a huge difference, then you've got a problem. Most of the time it's because you deleted something instead of clear contenting. The next tab is a new tab. This tab is called FTE. This shows how many FTEs you have for every cost center. It's broken down between core, harm reduction, clinic, hands, WIC, and all the other cost centers, so that you can see how many FTEs by those categories you have. We have also entered on this tab what the little people paper. That's what I've always heard it being called by everybody. It was some of the health department directors got together and created a document that showed how many employees each health department needed to do these core services that CADA has voted on and has accepted as what's being core. We have worked with several of the health departments to determine the cost centers that are going to be core, and those are listed here. Now, some of these cost centers are indirect cost centers, so obviously you won't be putting money there, but those hours should be used to calculate your FTEs because it's administrative staff. So this calculates based upon, when you first look at it, it's going to be what you've done through March annualized. So you need to make sure before you do anything that you've got your full-time, part-time salaries the way you want them before you start making decisions on employees. This is kind of a tool to kind of help you to see where you are as far as your FTEs and what you need and what you don't need. All of these FTEs are coming from this hours tab by cost center. And some of the health departments have moved to using staffing services to hire new employees. Those will not be included in your FTE calculations. The only thing that's included in your FTE calculations are employees that you're actually paying through payroll, which would be your health department employees plus any personal service contract employees that you have, because all of those are paid through payroll. So if you are using a staffing agency to hire employees, then on line 4 of this hours tab, you need to enter in how many hours by cost center you're contracting for somebody else to provide those services. So we'll just add some in here so you can see how this will work. So I just added some in. Those numbers carry down to the bottom here, which then come over here and change the FTEs. So if you are using GoHire or any other staffing services for your employees, you need to enter those hours that those employees will be working for you during this next fiscal year on that line, so it accurately calculates your FTEs. Because even though you're not paying retirement on those people, those are FTE people that you need to calculate. So that's the only new thing for the salary template. And as I've said before, only key in the yellow cells. FTEs, we've keyed in for harm reduction, which we base that on 50,000 population. We know all counties do not have harm needle exchange program, but we went ahead and keyed that number in for everybody, because if you plan on doing the needle exchange program, you could see how many FTEs we feel that you need to do that program. For the district health departments, the amount that was entered in for harm reduction was based up on all your counties. If for some reason not all your counties are doing the needle exchange program and you want the accurate number by county, please contact me and I can give you that information, because I do have it broken down by county if you want to look at it that way. All these other tabs, here is the FY20 pay period schedule. There is an employee benefits worksheet at the end. It does not feed anywhere. It just kind of is an assistance to you It's something that Randy Gooch shared with us a long time ago that he has used in the past to help calculate his fringe benefits that go on the first tab. The information does not feed there because it's not mandatory for you to use this. It's just there as a tool if you want to use it. So that is all that I have for the salary template. If anybody has any questions, please let me know. But everything that's on this FTE tab is going to feed to the clinic for clinic hours. It feeds the hands template, and I have hours that are feeding to environmental. So to help calculate FTEs for those categories, and we'll go over those then. But as always, I know that this training has been a little crazy. You can always contact your local health budget analyst, and we will assist you with any questions that you have. Okay, I'm going to save this just because it all feeds over. Usually we don't start with the salary, but I did this year because of the FTE thing. So we're going to go back in order as we usually do. The next thing is the environmental template. Enable contents, do data, edit links, make sure your location. If the status is unknown, you can relink. So I can hit change source. Find my jump drive, hit budget 20 and relink it to bud form, and it's going to say okay. And the same thing with the salary template. I can hit okay. So now the status is good, everything's linked together. We have loaded in your services that you have entered into the EMA system as of March 31st. If you're behind on entering services into the EMA system, they will not be in here. What is in the EMA system so far, we get this file from CDP, and that feeds over to the input environmental tab. In the yellow cells, it is only what you've done actually fiscal year to date. It's not annualizing, it's not doing anything. Nothing will end up in the budgeted services until you have entered establishments for each category that you have. So for food, you might have 20 restricted food concessions. Then you can see over here to the left in column F that because I entered 20, you have to do 2 inspections for every establishment per year. So it calculated 4. And then you can change these follow-up inspection and these complaint percentages, but the standard is 20% for follow-up and 10% for complaint. But you do have the option to change those if you want to where it's automatically calculating 8 for follow-up and 4 for complaint based upon that 20% and that 10%. And the office activity is equal to your total establishments. Those are all, the white cells are all formula driven. So you would only have to enter into the yellow cells to calculate your budget. So for everything that you have, you need to enter in establishments. If you're not doing those type of services in your health department, then you don't have to budget for those. Now, I will tell you that these do go to environmental, and if they know that you have those establishments, I would suggest that you budget them. So I'm going to go through here and I'm going to put establishments in here for all these categories that have something in here for, so we can do calculations. All right. Also on here, we have standard FTEs. So once you've entered in all your establishments and it's calculated your services for everything, I'm not going to go through and enter something in for every category, but at the bottom, it tells you how many hours, based upon the standard hours and the number of services that you are budgeting for, what your standard hours are. That calculation is going over to this FTE tab. Obviously, this isn't real because I don't have all the services in there, but based upon your budget, this budget, there's 2.64 hours for environmental. It's all the environmental cost centers plus cost center 901 is 2.64. Based upon your services, 0.82. Obviously, I don't have enough services in there, but after you get all your services in there, it's going to calculate based upon 1,240 hours. Because 901 is not taken into effect in the environmental template. We reduced the number of hours to do the calculation based upon services from the standard 1540 that we used for everything else, to take into consideration the hours that you would have budgeted to 901, so that it was totally based upon services. So they should be about the same. So based upon the services divided by 1240, the hours from the standard hours should give you a calculation, and then based upon what you budget on your salary, you can compare the two to see, you know, how you're doing as far as your FTEs. But there will not be an FTE calculation for services until you have completed your establishments and budgeted your services. When you look at it now, it's 0. So if you have any questions about that, please let us know. Okay, so I'm going to move on to the next template. Which is your contract template. I will say one more thing about the environmental template. Right now, you don't have any expenses in your BUD form, but the BUD form expenses will feed over to the environmental, so it'll calculate your expenses there too. I have a question. Somebody asked, I guess we need to enter rates. Yes, sorry, I'm trying to speed through this. On the 560 and 560 only, you need to enter your on-site sewage rates. So if you have 200 permits and you have $150 for a regular inspection and $200 for a site evaluation, you'll enter that, and based upon your services and so forth, it'll calculate your revenue and it'll go over to the BUD form. Granted, this is like way off, but it'll calculate money to go to the BUD form only for on-site services. So good question. Thank you. I forgot about that. Okay, so I'm going to save the environmental template because everything we just did is going to go to the BUD form. The next template is the contract template. This is where you're going to enter in all your independent contracts for services based upon the contract ID you can get from Mark Tibbles, who your contractor is, Dr. whoever, what cost center that cost is going to go to, and the minor object in which your contract is going to be for. Needs to know. So the contract template is, you're not going to, you know, we took off the mandatory contract minor objects. We don't have that option anymore because now it's, if you're going to provide a service and you're going to contract with an independent contractor to provide those services, that's the only ones you need to be putting on here. Not this may happen, so I need a contract for it. So for example, if you're not going to do family planning, then you don't have to have a contract for sterilizations. So I know that in the past, that was always a mandatory contract that you had to have. So if you're not going to be doing certain services, then your contract list is going to just disappear. But I'm going to put one in here just so you can see how it goes to the BUD form. All right. Because I have not hooked this to the form, because if we do data edit links, change source. So now, after I open the BUD form and save the BUD form, it should connect. Right now, because I don't have the BUD form open and I haven't been in the BUD form yet, that's why it has the yellow, red and yellow box. So if I close this and open the BUD form and I open this back up again, that will change to where they're both purple and they both equal. If for some reason that doesn't work, let me know and we'll see how to fix it, but that will always work. And for your contracts, you need to put who is going to be doing the billing, whether it's the health department or the contractor. So that's one thing that you need to put on there too. Somebody said, do we put contract for Go Hire here? No. These are contracts for only independent contractors, not for your Go Hire contract. Your Go Hire contract is an expense for your staffing. The only ones that actually go here are the ones that, unless you're using Go Hire for home health for like a physical therapist or occupational therapist and those kind of disciplines. If there's a discipline minor object in the independent contract listing, then yes, you can budget those here. If there's not a discipline for the minor object for a Go Hire employee listed, then no, you will not put your Go Hire contract here. Somebody asked if there will be separate contract training this year. My understanding is the communication should have already been sent out about that. That there is no longer contract training, that it was recorded last year, and that you can go look at that recording as a reminder. If you have any questions about where to find that recording, contact Mark Tibbles. Or the LHO help desk. Sorry, I don't have that information readily available, but that is my understanding about contract training. All right, let's save this. And we will go on to the clinic. All right, when you open up your clinic, it should open up to unduplicated. This is where you just enter in your unduplicated patients. There are some agencies, some programs that need this for their grants that they write for. So that's why they ask us to enter this in. So if you're not providing services for a particular cost center, then don't enter any unduplicated patients. So only enter the unduplicated patients for the programs in which you're going to provide services for. Here is where we loaded all of your services that you've done so far through March 2019. And these services feed over to the services tab, and in this, they're annualizing based upon 3 months. For a lot of your services, you can use the annualization, but there's going to be times that you don't want to use that. You can change this to a 1, and it just puts in what's from Data Mart. It doesn't do anything. You can change this to a 2, and it enters in what you've done so far this year. Or you can enter in a 3, and it annualizes it for you. There are filters to where if you want to look at it cost center by cost center, you can do so. I highly suggest you do that for WIC, so that you can go over here to the project column and make sure that all of your services are project eligible. As you can see, there are 8,994 services totally budgeted for WIC. But if you scroll over here to the project column, there's only 8,991. We don't know how it happens, but sometimes they end up in other cost centers. So my suggestion, other payers. So all you have to do is there's one in unassigned. So you just change that to a 0 and it gets rid of it. Where are the rest of them? There's some in Medicaid. I don't know why there would ever be WIC in Medicaid, but and it could be the CPTs. Well, and some of it's the CPTs because you shouldn't have some of these CPTs even going to WIC. So you need to check your CPTs and make sure that you have the right CPTs going to the right program. There was a switch over this year between the PEF entry system, and I believe that did cause some issues. So that could be why some of your services are not in the correct cost center. So I would program by program look at your CPTs and make sure that you have everything calculated and in the right thing, that all your CPTs are accurate in the right cost center. Instead of just, unfortunately, there have been times where people give us back the clinic template the same way we sent it to them. So I would take the extra time, get your clinic supervisor to go through and make sure that what is budgeted for each one of these. We talked about the W-9s during the PowerPoint presentation. You can filter it by CPT. You can go up here and hit text filter and says begins with W. And for not the WIC codes, but all these E&M visits that begin with a W, like this W9382, you need to go in and zero that out because it's not going to do anything. So all the W codes, you need to make sure you zero out those services. You can, when you enter in on the yellow cell under each one of these payers, it changes the budget number in the white. So the yellow cells can be entered on. We have entered in the Medicaid rates and the passport rates for all of the CPTs, and we've entered in the relative-based relative values, resource-based relative values. Those are used to calculate the spread of cost from 700 and 718 to all of your clinic cost centers. The only ones that don't have a resource-based relative value assigned to them are cost center 733, which is the dental hygienist program, and cost center 858, which is school health. Those services are still budgeted on the clinic and the red light path. However, those employees direct code to those two cost centers, so they are not included in the RBRV spread. So when you're doing PEFable services for all the other cost centers, for dental, for pediatrics, for family planning, for breast and cervical cancer, nutrition, STDs, TB, diabetes, when you're doing adult services, when you're doing actual PEFable clinical services, you do not direct code to those particular programs. You code to 700 and 718, and based upon the resource-based relative value assigned to that CPT, cost spreads to those particular cost centers. Same for WIC. We've assigned resource-based relative values to the WIC CPTs, and cost spread from 700 to 718 based upon those services. So it's very, very important that you budget what you actually are going to do or plan to do. Then we created an FTE tab. for this year. For all of the E&M visits and for the WIC visits and for the administration of vaccines, we have assigned time intervals in 15-minute increments. As a standard, I went through AMA, what AMA said the standard was, and if it wasn't based upon a 15-minute increment, which you do your schedule, we upped it. For example, AMA standard time for a brief new patient is 10 minutes. Because you all do your schedules based upon 15 minutes, we upped it to 15 minutes. So for all of these codes, it goes back to your service tab, finds out how many of these services you have budgeted by cost center, and then calculates time and is calculating an FTE. According to this example, this clinic's FTE services is 2.34 for the entire clinic. We kind of isolated WIC because WIC is not core, but it is part of foundational services that the health departments are going to be doing. So it calculates just for the clinic 1.05 is your FTE. However, we know that for every nurse, we used a 1-to-1 ratio between support and nurse for billing and so forth. So for the clinic, we did a 1-to-1 ratio plus 25% for supervision. For WIC only, we did a 1-to-1 ratio plus 11% for supervision. And in the WIC calculation, I incorporated the direct hours that were coded to cost center 804 because we know that some of the coordinators code time directly to 804 when they're doing folder reviews, chart reviews and stuff. So we have taken that into consideration. So line 4 is saying that based upon the services you budgeted, plus a 1-to-1 ratio times 25% for the clinic and 11% for WIC. So it kind of ups it. So even though your services say you need 2.34, we actually feel you need 5.86 for support and supervision. And then from 700, 718, and 899 for all of your clinics, it shows how many hours you got budgeted. So in this instance, based upon your services, you really only need 5.86 FTEs, but based upon the hours you have budgeted, you have 8.40. So you got to look and see if you're truly overstaffed or if either you don't have services budgeted correctly or you don't have hours budgeted correctly. But this is just a tool to show you what you look like as far as FTEs. And the same with WIC. Based upon services, needs 2.34. Based upon hours budgeted is 3.91. But also for WIC, we calculated an FTE based upon participants. I took an average participants for calendar year 2018, and we did a calculation based upon your participants using the same 1-to-1 ratio and 11%. So based upon participants, we have entered in how many FTEs you should have for participants. In a real world, in a perfect world, you would think that the WIC FTEs based upon services, the WIC FTEs based upon hours, and based upon participants are all the same number. If yours turns out that way, great, you're on the right track. If it doesn't turn out that way, then you need to evaluate whether or not you're coding correctly. Some of it could be a coding issue, or whether or not you're scheduling the way you need to be scheduling for your services. So all this FTE stuff has just been put in there as a tool at this point to help you see what everything really looks like. Good question. Okay. Somebody asked, if we were utilizing an employee from another health department, where do we put those hours? Contract or the new staffing tab? Okay. As far as FTEs, you're going to put them on that salary tab to calculate FTEs for those. If you're contracting with somebody else so that you're accurately contracting your FTEs, you're going to put them on that hour salary tab in that yellow. As far as the expense, you're going to put that, I believe there's an expense account for contract with other health department. So you're going to put that expense on there for that. So it does not go on the independent contract template, and it does not go under the staffing. If you're contracting with another health department, there's a separate line item for that. And somebody has asked, referring back to the salary template, I assume the higher retirement rate is preloaded. Yes, that is correct. Sorry, I should have gone over that. The retirement rate on the budget templates is 83.43%. Because as of right now, that's what the percentage is going to be for FY20. So you will have to do your budget based upon the 83.43%. We do not know at this time when a special session is going to be called. So we feel that you need to do your budget based upon the higher percentage on the higher cost rather than the lower, because it might not happen between now and June 30th. So hopefully that helps answer your question. So as of right now, budget submissions are at 83.43%. Okay, that's all I pretty much have on clinic. Let's save this. Oh, I will say this, the only revenue that is calculated on the clinic that goes to the BUD form is Medicaid and passports, which is all the MCOs are lumped together except for passport. All your other revenues for your self-pay and your insurance, you will have to enter those on the BUD form yourself. Now the RADLAB Path template is set up just like the clinic template. However, it does not have an FTE tab and it does not have an unduplicated patient count tab. But it's designed the same way. You have data mart, which is your services. Which is your services based upon through March. And it also has rate tabs and a weight tab, so it can spread costs from 718 to those particular cost centers. Please look at this by cost center. Sometimes non-lab CPTs end up in lab and vice versa. Labs end up in the clinic. Make sure when you're doing your budget that only lab codes are in the lab template and clinic codes are in the clinic template. I don't know if it's data entry or what happens, but sometimes they get switched back and forth. So that's another reason why you really need to look at all your CPTs and all your cost centers to make sure that they're budgeting accurately, because that affects the spread of cost, affects FTEs, and so forth. All right, I just got an email question. Hold on. All right, somebody wants me to explain the calculation of cell K on the clinic. Okay, so the RADLAB path is just like the clinic. It works the same way. Filter, make sure you zero things out that aren't pertinent. Make sure that WIC is only budgeted to project because nobody else pays for WIC services except for WIC, and so forth. But I'm going to go back to the clinic template. To explain cell K. Okay, column K. Oh, okay. Now, the 1.05 that's in this example is calculating your hours divided by 1540. to get, that's your total FTE hours. Based upon your services, you have an FTE of 2.34. Based upon, which is a 1-to-1 ratio of your budgeted services, so 1.05 plus 1.05 times then 11% added on for supervision. The FTEs based upon budgeted hours comes from the salary template. What we did is we took what percentage of the 1.05 was to the 2.34 in column F, and then took that percentage from the 8.4 and added what was direct coded in 804. So that's how that's calculated. And then the 2.31 is based upon your average participants, which is also a 1-to-1 ratio, and 11%, saying that for the calendar year 2018, these are your average participants. We stuck it into a formula, and we can share it because it broke it down by clinic, supervision, and support. So if you want it broken down that way, we can provide that information to you on a one-on-one basis. Just ask for it. And I hope that helps. If you have any more questions about that, just let us know and we'll kind of go through it with you. I mean, there are formulas in here if you know how to back into them. The participants know, yeah. But there are formulas for most of it. But if you have any questions, just let us know and we'll try to talk to you on a one-on-one basis. I have another question. When will MCH package be sent out for selection and plan submission? Andy Waters just left, so I don't know. I do know that in the beginning we went through the plan packages. So I guess you can contact Jan Bright or Anita Martell and they can answer that question, but I'm sorry, I don't know the answer to that. All right, now let's leave the clinic. Make sure there's no more questions. I'm still trying to get this done by 1. Okay, so we've done clinic, done our life path. Supplemental. Okay, there are some changes this year to supplemental. If you've already looked at your allocations, you're going to see a Medicaid allocation to cost center 752. Medicaid has agreed to pay for multi-grad services. So you're going to have a general fund to 752 allocation, 422 allocation to 752, and a 463 to 752. The services that we loaded, we didn't know if they were Medicaid or non-Medicaid patients. So we loaded all of them as non-Medicaid patients. So you will have to, add those in. If you look in column C, you can also look at this rates tab. It'll show you what the code is that has to be entered in for 752. The 2 on the end, if it is for non-Medicaid, and the 7 is for Medicaid. So for 752, you put in your CPT code and M2 for non-Medicaid services, and then your CPT code M7 for Medicaid services. But you can enter in everything on here. If you enter directly to this cell, even though it's formula, you can, and I'll add some Medicaid services. You shouldn't have the issue this year as you've had in years past where it won't feed over. I think I've corrected that problem to where before you had to put in single quote and before you put the cost center number in. As you can see, I didn't do that this time, and it calculated the rate. And as I said before, the M7, the M2, the P2, and the P7 determine what column your services go into. Now, not everybody is getting the 760 allocation because the grant only approves for so many counties to have that grant funding. So I do know that everybody got 752 and 853 that are going to be doing services, but only a select few got 760 funding. So based upon your funding, you can see how that looks and so forth. But this feeds over to the FTE tab. We have calculated FTEs for professional and paraprofessional as 600 visits per one FTE, and assessments is 360 visits is equal to one FTE. So over here in column B, based upon your services, you should have 3.77 FTEs. And based upon hours, it's 2.74. Just in this example, obviously yours is going to be different. So, but that's the calculation we did based upon services, and then it's feeding in hours from 752, 760, and 853 to calculate the budgeted hours of FTEs. But this kind of gives you a to see how your FTEs and how you're budgeting, and if your employees are doing enough services to cover the FTE service to hours ratio. Okay, I got a question. So what we'll be using the 760 for? We are one of the federal grant recipients from the get-go. Okay. Medicaid is only going to be paying for the Medicaid clientele for the services. So you're still going to have non-Medicaid patients. You'll have to get further guidance from program staff as to how they're going to determine when the 752 422 money is going to pay for the non-Medicaid multi-gravida patients, and when the 760 is going to pay for the non-Medicaid multi-gravida patients. I'm not sure how they're going to differentiate between those, but all of this came down rather quickly this week, so we're still trying to figure all that out. But I would send Andy Waters an email asking him how to differentiate between those services. Those FTEs will not necessarily lead to full drawdown of allocations, correct? That is correct. Your allocations may be different amounts. You need to budget your services based upon what you're going to do, and it calculates the appropriate FTEs based upon those services. I do know they did your allocations based upon the services that you've done so far this year, and that's the services that we pulled in is what you've done so far this year, and it's annualizing those for you. I will tell you that whatever revenue you calculate in the supplemental feeds over to the BUD form, so you do not put your allocation amounts in the BUD form. It automatically calculates for you based upon your services. However, if your allocation is less than what you have budgeted, then you're going to have to reduce your services. Allocation is only equivalent. You can only budget up to your allocation. You cannot exceed your allocation. Somebody has asked, where is the hands administrative FT calculated? It is not calculated in here. The hands administration FTE is not part of services. So therefore it is not included in the FTE calculation for hands. That is an employee that, yes. So they are going to, those are funded by DPH. So you need to talk with DPH about that funding. They should not be included in the core hands portion of foundational funding services because they're not doing actual services. So that's totally separate and is totally separated separately. Okay. The only other thing we haven't gone over is home health. Nothing has changed with home health. You enter in your services and the revenue spreads over to there. It's pretty much self-explanatory and hasn't changed. So enter in your home health services, your reimbursement rates, which calculates your amount of receipts that are going to go to the bud form. Somebody has asked, was supervision for hands calculated in the FTEs? And the answer to that is the only thing that is calculated in hands FTEs is the hours that are coded to 752, 760, and 853. So for your agency, they should be coding, if they're doing hands supervision, they should be coding to 752, 760, or 853. The other question was about the TEs. Those are not in there. So 760, 853, and 752 are the only things that are part of the FTE calculation. And that's
right. It relates to those allocations that you do services for.
Right. All right. Somebody asked, do we still enter supplemental for 813? And the answer to that is no. It's really not a supplemental anymore. It's just hands. The only thing we budget for is hands. And years ago, people used to enter their supplemental services on the supplemental, but we don't do that anymore. All right. Okay, now that we've done all these other templates, we get to the nuts and the bolts of everything and how it's all connected. The first tab that hopefully will pop up if we do what we want to is you need to enter in the date of your board meeting, or we're going to ask you. If you didn't submit your board minutes in when you submitted your budget, then we're going to ask you when your board meeting is. If you don't want us to ask you, enter it in right here so that we know and we can take note of when your board meeting is. If you're budgeting a salary increment, if you don't want us to ask you, you need to enter in the amount. It just makes things a whole lot easier if you just fill out the boxes. So if you're budgeting a salary increment, put in the percentage that you're budgeting for. The next tab is for local receipts. We have already entered in your 1.8 minimum requirement for each one of your counties. So you need to only in cells C and D and E based upon how you're funded. If you're have a public health tax in your county, then you're going to enter in how much you're going to budget for your tax in column C. If you're a CH31, and you get your money from the fiscal court, then you're going to enter the amount in column D. If the city gives you money, to help fund your health department, then you're going to enter that in column E. The next tab is square foot. For every cost center that has budgeted salary, you need to enter square feet. If for some reason you have a pass-through employee that does not sit in your building, then you don't want to assign square feet to. You can, which is usually in the 8. Well, this health department don't have any. If you have one, you can change this to a Y, and that enter square foot goes away. But if it says enter square foot, then you need to enter square foot. In this cell F9, you need to enter in your total square foot. So if you have 50,000 square feet, enter 50,000 square feet. What's going to happen is until you allocate that full 50,000 square feet, that box is going to stay red. If you want to get rid of the red box, then you need to allocate square feet to every cost center that has direct salary, unless the salary for that cost center is not sitting in your health department. I'm gonna skip that one on purpose to show you what happens. This also spreads your 897 cost to your cost centers. So you want to spread it accordingly, and you want to make sure that you don't over allocate, because the red box won't go away if you over allocate, as you can see in this example here. So you have to go through and adjust some. Okay, as you can see, I have 50,000 square feet and I've spread 50,000 square feet, and it's exactly equal. However, I bypassed one. So you really think that everything's good, but it really isn't. Because when we go to look at it, we're going to see one that doesn't have one. So you're going to have to put square footage there and reduce somebody to get the 50,000 in there. So we do look at these. We do make sure. And I will tell you that only budget square foot if you're absolutely positively sure you're going to be doing that program in fiscal year 20. Just because you might be doing that program in fiscal 20, I wouldn't budget square foot, because in July, we're going to tell you, take your budgeted square feet and enter it in to change your square feet for FY20. So you can reallocate throughout the year, and it's a whole lot easier to reallocate from one place to another instead of taking it away, because once you enter in square feet into the system for FY20, there's going to be costs to go there until you zero that out, and you can't get rid of that cost. So if month 1 for July, if you have square foot somewhere and you're not going to do that program all year, and you change it after you've already done financials for July, you're stuck with that cost there. So I would only do my budget for what I 100% positively know that I'm going to do for FY20, especially when it comes to salary and so forth. Okay. The question is, what if you are entering space to an FQHC within your health department? FQHC is actually, I'm assuming, renting space from you. So that space is not yours. So I would not enter that in as your total space because that's not what you're entering. That's not what you're using. You only want to use the square footage that you're actually using for your agency.
But if they're getting rent and they want expenses there, then
But they would be for a particular cost center.
some of them have cost centers. Anderson County has cost centers. Well, they don't have salary.
We'll have to look that on a case-by-case basis. It just depends on how your whether your board's getting the money for that space, whether you're getting the money for that space, and how you're going to account for it. So if you are renting space out, you need to contact us and explain to us how you're doing that so we can tell you the proper way to do that. Okay. Here's the bud form. This is where everything you've done so far is feeding into here based upon your expenditures. As I said before, enter in the yellow cells. Use your most current financials to determine how to budget your expenses. This is where you need to enter in your expenses that were not created based upon everything you've done so far. If expenses were created based upon what you've done so far, those cells are white, so you don't have to re-enter those in. Salary is already included in here. Independent contracts is already included in here. Now it's time to put that's coded directly, like your travel and your space costs, which most of that should be going to $897. Very rarely do you ever have space costs anywhere else besides $897, but occasionally you might have rent directly to a program, but for the most part you don't. Office operations. Here's one thing that causes budgets to get denied is because health departments get confused between 581,343 and 581,349. 581,343 office supplies should only be coded to indirect cost centers because that's supplies that anybody has access to. But if you're purchasing supplies for a particular program, then you can direct code those to a cost center, and those will be coded to 581,349. That kind of isolates those supplies, and it doesn't spread that cost to all programs. Whereas, you know, stock paper to go into the printer would be a 581,343. But if you want special paper for the hands program that's colored or whatever, then you would code that to 581,349 in the hands cost center. So that seems to get a lot of people caught up, getting those confused. You would do your direct salary expenses for your automotive or your other operating. Those things don't come in, but your indirects are based upon what you code in 700 and 718 for the resource-based relative value. All that's done in clinic and lab, so you don't have to do anything with those. But your expenses from departmental and direct 898, you code your expenses in 898 and it's going to spread. For space, you code your expenses to 897 and those are going to spread. And all of those spread based upon the percentage of salary that you have direct coded. All of that is automatically done for you. Then you have revenue. First thing I would do is go through and enter in all my allocations. However, do not enter in allocations for hands. Those are directly fed in here, and I will show you. So we have 752 has a amount already in it for the state money, 422 money, and it also has an amount in here for 463. We didn't have anything for 760 on this one, but 853 does the exact same thing. There's a Medicaid amount and there's a 422 amount. Do not overwrite those. Those are coming from the supplemental template, and those need to be equal to the supplemental template. If for some reason you overwrite them, we will fix the formula. We will send it back to you and tell you if you want those numbers to change, then you need to change your supplemental template. Do not change those on the bud form. They are white cells. Do not change them. The other revenue that comes in over here is the MCOs other than Passport come in on line 191, and then Passport comes in on line 2. So all your clinic revenues that are budgeted on the clinic and the Rad Lab path for reimbursement, those will automatically feed over here. Home health does as well. So if you do home health and you budget for all the MCOs, then those do feed over to the bud form, as well as insurance and self-pay and stuff. Most of that feeds over for you for home health. However, for clinic, you will have to enter in your insurance and self-pay. The self-pay for on-site sewage comes over from the environmental, so you don't have to do that one. It's a white cell also. So line by line, you need to enter in your revenue and use your most recent revenue expense report to kind of help you guide you where you need to put stuff. This is also a good time to look to make sure you don't have any miscodings for the fiscal year. As you're going through your revenue expense report to do your budget, you might find things that aren't coded correctly, so you can fix them before closeout. 428 allocation is down at the bottom, and 451 is an automatic. The local tax dollars is an automatic spread if you put a 1 here. If you don't want it to automatically spread and you want to manually enter it in, then you would change this to 0. If you want to automatically spread it and change it, you can. So like, let me go back. So it's automatically spreading based upon the deficits. But say my board doesn't want any money, any local tax dollars going to 500, which will never happen. But so you can change that minus 36,178, and then I can move that 36,178 to another cost center that needs money. Or I have enough local money based on our stuff, so you can put it there. So where it balances it out. And when I did that, it automatically used unrestricted. This shows you how much unrestricted you have available to use to balance out your budget. Everything you do on the bud form comes over here to a summary of all programs. This is kind of like a one-sheeter that you can give your board so that you can show them how your budget flows. This is also something you can use to compare to your 117 to do line items for. The plan tab has the percentages for Medicaid match. This year, there will be an increase for expanded, and effective October, K-CHIP will go from 0 to 8.33. So we've done averages for all of those. If It automatically will calculate family planning based upon what you budget for family planning, and the same for breast and cervical cancer, and then the rest of it goes to traditional. So you can change this amount. So if you take $50,000 and put it in expanded, you can see that the traditional decreased, and the same for K-CHIP. To put those at the lower rates, make sure you actually, look at for this year, you've been billed for 3 quarters so far. Yes, that was based upon FY18, but you can use your 1502 reports to kind of see what your percentages are for expanded and K-CHIP and adjust those accordingly. As you're doing your Medicaid receipts, if you feel that you have too much calculated for your clinic cost centers, you can put it in a percentage of denial, because we know that there's claims that are going to get denied and so forth. So you can put a percentage in here and it will decrease your amount that you have budgeted on your BUD form. Yes, the clinic and the Rad Lab path will calculate it based upon the higher rate, but you can decrease the total amount for each cost center if you feel it's not realistic based upon the budgeted services, because sometimes that does happen. The indirect spread just shows you how all the indirects are spread and what the cost centers are spread to and the percentages. Then we have the SPGE tab, which assists you in uploading your stuff to local government, and then there shows the crosswalk. That's the BUD form in a nutshell. I got through it a lot better this year than I did last year. I ran out of time last year. I know this budget training has been crazy, and I apologize for that.
A lot of people may not heard the salary template.
Yeah, we got 15 minutes left, so I'm going to go back to the salary template and kind of show you the changes on that, because I don't think everybody saw that because it was on Zoom and we were getting cut in and out. All right, the biggest change on the salary template is this hours tab. This is kind of what I was talking about. If you're contracting with another health department or you're contracting with a staffing agency, then you need to enter those hours on here so it accurately calculates your FTEs. You enter them in on row 4. They calculate down here at the bottom, which then goes over to the FTE calculation. Personal service contracts are already calculated on the salary template because you are paying them through payroll. And so they're either going to be on your full-time or your part-time salary tab based upon the number of hours that they work. Most of them are on your part-time. So you're already got those on here. So you don't have to worry about the personal service contracts. Only worry about the ones that you are hiring through GoHire or any other staffing agency, or you are contracting with another health department to provide those services. I know some counties side by side contract with each other for environmentalists. Say your calculation for services doesn't warrant you to have a full-time environmentalist, or it doesn't warrant you to have 2 full-time environmentalists, and your next door neighbor doesn't really warrant them to have 2 full-time environmentalists. So one of you might have 2 full-time environmentalists, but one of them goes between 2 different health departments. So if that happens, then you can add those hours to this as well so that it accurately calculates your FTEs. As I said before, we entered in with the little people paper, I don't know what else to call it, calculation shows that you should have for your core, what it is for harm reduction. And this is where the clinic FTE came from, as well as the hands FTE and the WIC. And then here's the FTE for all your other programs. This was based upon 1540 hours, which is the calculation that some of your other health department directors came up with as a standard FTE to be calculated for. It took into consideration your holidays, your leave time, and your breaks, because every day you get a 30-minute break. So it's calculating FTEs by actual hours worked, not the 1950 that you're scheduled for, but the actual hours worked. Well, that is all that I have. I hope this has been helpful. If you have any questions, please contact your local health budget analyst, and we will assist you any way that we can. As we said before, allocations went out yesterday, so you should have access to those. Budgets are due by close of business May 24th. If for some reason you cannot meet that May 24th deadline, you need to let us know as soon as possible. As soon as you know you can't meet that deadline, you need to let us know. Please do not wait till May 24th and say, hey, I'm not going to be able to submit my budget until June. Do not let your board meeting prohibit you from submitting your budget. Please go ahead and submit your budget as soon as you're completed with it, so it can be in the review process, and then you can have your board meeting. If for some reason your board votes on something that changes your budget, just let us know. We can put it back through the review process if need be. A lot of times the changes that the board makes only changes our review. It doesn't change program staff's review. So if it does change program staff review, we will send it to the appropriate programs and have them re-review it. It's just a whole lot easier to go ahead and start the review process instead of waiting so much longer, because there are 61 health departments that we're trying to put through the budget process. But I hope y'all have a great afternoon, and hopefully next year we won't have this much trouble. So I'm going to get off here. So thank you, and y'all have a great day.